Should you be getting a partial or a total knee replacement surgery? It really depends on how bad the knee arthritis is in your knee joint and the skill of your surgeon. You need to be a good candidate for a partial knee replacement, and the surgeon needs to be well trained in doing them because not all surgeons know how to do partial knee replacements or are confident in doing them if they do know how to do them. Total knee replacements, where the entire surfaces of both bones are replaced, that's the most common knee surgery. What they'll do is they'll shave off the ends of the thigh bone right here. Here's the thigh bone, here's the kneecap, and the shin bone. Those make up the knee joints. They'll shave off the ends of the thigh bone right here, and then they'll shave off the top ends of the shin bone and replace both of those surfaces with artificial metal parts. And then in between the two surfaces, they'll put a big plastic chunk that replaces your meniscus. They'll usually replace the back side of the kneecap right here. They'll shave the back of it off and put some plastic part on there that interfaces with the metal parts on the end of the thigh bone. That's a total knee replacement. Now, a partial knee replacement is when they only replace one half of the joint. Now, there's three compartments in a knee. There's what they call the medial compartment, which is on the inside part of the knee, the lateral compartment on the outside part of the knee, and then where the kneecap touches the thigh bone right here, so the patellofemoral compartment, and that's another part of the joints. They can replace all three, but the most common partial knee replacement done, like plus 90%, is the medial compartment. They call this a unicompartmental knee replacement. So they'll shave off the end of the bone right here on the thigh bone, this knobby part right here, and then they'll shave off the top part of the shin bone right here, put metal parts on both of those, and then a plastic part that only fits between the two metal parts on one side of the joint. In order to have this type of surgery to be a good candidate, you have to only have knee arthritis on one side of the joint, and then the other side has to be okay. Now, usually the people that have this kind of situation are very bow-legged, and they'll do a surgery to kind of correct the bow-leggedness while replacing only the inside part of the knee joint. Now, let me tell you about the benefits of a total knee replacement. The main ones are that most knee surgeons that do knee replacements know total knee replacements very well. So you're going to be more successful in having a good outcome because of the surgeon if you get a total knee replacement, because that's the main thing that they train on when it comes to knee replacements. Also, another benefit is that the tools that are used to do the cutting, to do the measuring, to do the alignment, all the different components that go into the surgery, there's much more tools for a total knee replacement than partial knee replacements because those just aren't as commonly done. Now, some surgeons out there think that if you have any joint arthritis in your knee, it's better to just replace the whole thing because what they tend to see is people eventually get it on the other side. So their mindset is you might as well just have one surgery, because if you have a partial knee replacement, then eventually they think that you're going to get it on the other side, and so you're going to have to go through another surgery later on. So their argument is, why not just do one surgery instead of two surgeries, a revision surgery? However, there's something you need to know about. I'm going to tell you about muscle imbalances and how you might benefit from only having a partial knee replacement if you're aware of these muscle imbalances. This is something that surgeons aren't aware of. Now, let me tell you the benefits of a partial knee replacement surgery. The recovery time tends to be quicker, not always, but because it's a little bit less invasive. It's still quite an invasive surgery. They're replacing your joint. They aren't cutting off the entire ends of the bone, so you technically have less healing to do. The incision tends to be a little bit smaller as well, and people tend to have better range of motion in their knee afterwards compared to a total knee replacement surgery. And then in the event that you do need to have another surgery later on, a revision, like maybe you need to upgrade to a total knee replacement, you still have a lot of bone left over for them to be able to do the total knee replacement surgery if you have to go back to that. Now, a downside to the partial knee replacement, like I said, there's less tools available, so you have to kind of search and find the right doctor that does these. I would look for a doctor that does 20, 30 or more a year partial knee replacements, because if they're doing 5 or 10, anything in that range, then they're probably not as experienced with doing the partial knee replacements, and you're probably signing up to be a guinea pig of theirs to get so that they can get better at it. And if you're okay with that, then that's you. But I don't know, if I was getting a partial knee replacement, I would want it done by an expert, so I would go find the guy that does them all the time. It's a bit more of an art to do the partial knee replacement because there aren't tools available. So you need somebody who is experienced in knowing how much to cut off, what kind of alignment to do, because the tools just aren't there compared to a total knee replacement. Now let me tell you about muscle imbalances and knee replacements. Something that surgeons and even physical therapists aren't trained to identify and treat is a muscle imbalance. And the way this works is in your knee, in your leg, you have muscles on the front of your thigh called the quads, muscles in the back of your thigh called the hamstrings, then you have the calf muscles down here, and up at the hip you have the glute muscles on the back and the hip flexors on the front. When you have an imbalance, the most common imbalance is that the quad muscles are much too strong relative to the other muscles in the area, and it causes a lot of pressure to build up at the knee joint. The hamstrings can be involved in this and getting too strong as well, and that'll pull the knee joint together too much and cause a lot of compression. Even in somebody that has had a knee replacement already, this imbalance can be there. The surgery doesn't fix it, whether it's a partial or a total knee replacement. That does not fix the imbalance. So you can still have chronic pain even after having a knee replacement. This is why the revisions are done for people that have partial knee replacements. But now leading up to a knee replacement, you probably had knee osteoarthritis, and the root problem of knee osteoarthritis is often this imbalance that causes excessive pressure. So it stands to reason that if you never address the muscle imbalance going into a knee replacement surgery, whether it was a partial or a total, you probably still have that muscle imbalance. And it's imperative, it's so important for you to treat that muscle imbalance so that you can have the normal pressures that the knee joint is supposed to have in your knee, because then you set yourself up to have as little or no pain as possible. Not many healthcare professionals will tell you about muscle imbalances. They may mention it, but not really know how to identify it or treat it. I talk about it at length on this channel here, and I've linked some playlists and programs that we offer down in the description below on this video. Go check them out. There's one called the Knee Arthritis Recovery Program and the other one called the Failed Knee Replacement Recovery Program. And then we've got playlists of videos that we have on YouTube called the Knee Arthritis Help Playlist and the Failed Knee Replacement Help Playlist as well. Go check those out, and please share this with a friend that you know that's suffering with knee problems so that they might learn about muscle imbalances. And then also give us a thumbs up and share our videos, subscribe to this channel, and turn on our notification bell so that you don't miss out on any of the helpful videos that we post each and every week. Thanks so much for watching. I'll see you in the next video. Bye-bye.